Generalized bone disorders. Achondroplasia. Achondroplasia is caused due to failure of ossification of long bones, resulting in dwarfism. Dwarfism is disproportionate, that is, the trunk is marginally affected. The limbs are out of proportion with the trunk, and there is shortening of the proximal segment of limbs. The disease has autosomal dominant inheritance but can also arise from fresh gene mutations. Features of achondroplasia: large skull with a bulging vault and forehead, flat nose, short limbs, short and stubby fingers, increased lumbar lordosis, spinal canal stenosis. Intelligence is normal. Other causes of dwarfism include dyschondroplasia, diaphyseal achalasis, cretinism, malnutrition, Hunter's disease. The second one is osteogenesis imperfecta, also called as fragilitas osseum or Vrolik's disease. This disorder is characterized by frequent fractures because of weak and brittle bones. This results from defective collagen synthesis and affects the skin, sclera, teeth, and the ligaments. The inheritance is autosomal dominant. The patient has tendency of frequent fractures with minimal trauma. Tendency to fractures reduces with age. Features include blue sclera, joint laxity, otosclerosis. Patient with severe type do not survive beyond few years. Causes for easy fracture includes osteopetrosis, osteomalacia, poliolimb, osteoporosis, and osteogenesis imperfecta. The third one is diaphyseal achalasis, also called as multiple exostosis. It is characterized by multiple cartilage-capped bony outgrowths from metaphyses of the long and flat bones. The inheritance is autosomal dominant. Basic defect is due to remodeling. The X-ray shows trumpet-shaped metaphyses and bony projections. The exostosis causing symptoms is excised. It is also called as HMO, that is hereditary multiple osteochondroma. The fourth one is osteopetrosis, also called as marble bone disease or Albers-Schönberg disease. It is characterized by dense but brittle bones, because of which they are called marble bones. In autosomal dominant, patients have tendency to fractures, and in autosomal recessive, the child has severe anemia, jaw osteomyelitis, cranial nerve palsies, but the patients do not survive for long. The next one is osteitis deformans, also called as Paget's disease. It is characterized by progressive bending of bones. The bones become thickened and spongy. The most common bone affected is the tibia. Cause of osteitis deformans: there is a defect in osteoclast function, so there is irregular bone resorption and increased turnover occurs. Onset is after 40 years of age. Initial stages, the bone is soft and vascular. In the later stage, it becomes dense and harder. Features include dull pain and bowing of the affected bone. Complications include pathological fractures, malignant changes. Treatment: calcitonin or diphosphonate. Then we have histiocytosis X. Histiocytosis X comprises of a group of diseases characterized by proliferation of histiocytes in the bones. 3 clinical entities are noted, that is eosinophilic granuloma, Hand-Schüller-Christian disease, and the Lederer-Sieve disease. Eosinophilic granuloma: There is solitary bone lesion. It is seen in the femur, tibia, spine, and ribs. Patient presents with dull pain or pathological fracture. Treatment includes curettage and bone grafting. Hand-Schuller-Christian disease. It is a variation of eosinophilic granuloma, where lesions are found at multiple sites. Lederer-Sue disease is the most severe form where there is involvement of multiple bones. The onset occurs at childhood and progresses rapidly to death. The next one is osteochondritis. It is a group of miscellaneous affections of growing epiphyses in children and adolescents. Osteochondritis is classified into crushing type, osteochondritis dissecans, and traction osteochondritis. Some common osteochondritis: Perthes disease, site affected the femoral head. Tanner's disease, site affected is the capitulum. Kienbock's disease, site affected the lunate bone. Sevier's disease, site affected the calcaneal tuberosity. Osgood-Schlatter's disease, the tibial tubercle is affected. Kohler's disease, the navicular bone is affected. Freeburg's disease, metatarsal head is affected. Sherman's disease, the ring epiphyses of the vertebrae are affected. Calv's disease, the central body nucleus of the vertebral body is affected. Isellin's disease, the fifth metatarsal is affected. Avascular necrosis, also called as AVN. It occurs due to loss of vascularity of a part of the bone, commonly after a fracture or dislocation. The common site includes AVN of the head of the femur. It occurs in adults between the ages from 20 to 40 years. Causes is idiopathic, alcoholism, steroid therapy, sickle cell disease, postpartum necrosis, and Casson's disease. Diagnosis: it occurs bilaterally in 75% of the cases. Pain in the groin or in the front region of the thigh is seen. The pain increases on exertion. X-ray appears normal in the early stage. In the later stage, osteolytic lesion is seen in the superolateral part of the head. Diffuse osteosclerosis of the head is seen. The shape of the head may be maintained. In the advanced stage, the head collapses. Treatment includes cord decompression and fibular grafting is done if the head of the femur has not got deformed. Muscle pedicle bone graft, that is the tensa fasciolata, is used if the head gets deformed. Intertrochanteric osteotomy in some cases with involvement of part of the head, and total hip replacement in case of advanced osteoarthritis.